Methods of intake of medical marijuana. Much to surprise of many patients, medical marijuana can be administered with a number of methods and does not have to be only smoked. These include oral methods, such as capsules and drops under the tongue, or sublingual, edibles such as gummy bears, cookies, and candies. Skin or topical methods include creams, gels, and patches. Vaping can be done with an oil or directly with the flower. Smoking marijuana is well known to the masses. Rectal or suppositories is an option with limited appeal, but can be invaluable in certain patient populations. Let's explore all of these methods in more detail and assess their pros and cons. Oral. Capsules is one of the easiest methods, which is quite familiar to most people. The capsules pass through the stomach and then liver, where the medical marijuana gets metabolized extensively. The effect is often delayed by 1 to 2 hours, but lasts 8 to 10 hours. A capsule that is too big in dose can be made smaller by freezing and then cutting it. No matter what the dose a doctor recommended, you should always start at a 5 to 10 milligram of THC and work your way up gradually, following the principle of start low and go slow. Sublingual drops. This is typically a tincture based in alcohol as the solvent, applied under the tongue with a dropper. Alternatively, the medicine may be loaded on a syringe. The effects are faster than the oral capsules. Many different choices are available in terms of strength and THC and CBD ratios. It is not clear how much of these drops really get absorbed from the mouth versus the stomach. Most manufacturers have not done scientific studies thus far to study the absorption profile. Topical. Creams, gels, and patches, when applied to the skin, result in passive diffusion across the skin barrier with variable success. The effect is local, but some likely systemic, as the medical marijuana is bound to seep into the bloodstream and go all over the body. However, this systemic effect is quite faint, and the chance of you being high from topical medical marijuana is rather slim. This is a benefit in the elderly population, where we do not want to make people fall by making them confused or high, causing an altered mental status. The agents can be applied to any area of the skin, but the inside of the wrist is a popular choice. Some people are also considering the hairline of the neck as a potential area for migraine purposes. Inhalation. Vaping and smoking would technically be considered inhalation. The difference lies in the temperature. Vaping or vaporization takes place at a lower temperature while smoking at a higher one. For sake of simplicity, we will equate vaping with baking and smoking with broiling. We often bake in our kitchen at 350 degrees Fahrenheit and broil at 500 degrees Fahrenheit. The benefit of vaping is that it leaves other cannabinoids such as terpenes intact. Vaping a clear oil-based medical marijuana is likely to give you very little, if any, combustion products, like tar. Vaping done with a liquid filter, such as water, is an instrument called a bong that many people may be familiar with. Different types of concentrates are available for inhalation, including rosin, crumble, powder, THC, and shatter. Dabbing is an advanced technique for strong effects. A lot of people worry about smelling like a pothead with medical marijuana, specifically with vaping. But in reality, vaping hardly leaves any smell on the user. The effects of vaping are fast, starting within seconds to minutes and last a few hours. There was a concern of people becoming sick with vaping in the USA, but most of the cases seem to be linked to nicotine vaping and from illegally bought vaporizers. Whether smoking or vaping marijuana is deleterious for your health, such as causing lung cancer and COPD, has not been studied adequately. The evidence is inconclusive. The flower comes in many strains, or cultivars. They are indica, sativa, and hybrid, but then also have further funny names attached to them, such as GSC for Girl Scout cookies and 9-pound hammer. The THC component of marijuana varies from 5% to 35%. Beginners should start from a flower with less THC concentration. Blueberry is such a strain. Some dispensaries have really potent flower with high THC concentration. These dispensaries include Rise and One Plant. Suppository. While not convenient, suppositories have a place in treating Crohn's disease and pelvic pain, especially in women with menstrual cramps. Rectal mucosa is deeply supplied by blood vessels, and a huge amount of medicine gets absorbed and bypasses the liver. Hence, bioavailability is very high. Some women also find that suppositories can be used in the vagina. It is noteworthy that not all dispensaries are currently carrying suppositories. Fluent, formerly Knox Dispensary, has several to choose from. Summary. So, in summary, the registry in the state of Florida provides all of these options for the patient for intake of medical marijuana. The doctor can recommend one or more options for the patient for both low THC cannabis and medical marijuana. There is no limit on how many methods you choose. You should bring to the attention of your doctor which methods you find suitable for yourself.